why are we seeing a rise in cases? Well, we're not seeing the rise in cases that we were expecting. It's starting to fall a bit now, hasn't it?
Is it? I don't know. I thought we haven't reached the peak.
Well, it's a little bit confusing because last week, about a week ago, we were hitting just under 1,000 deaths.
Yeah,
Now we are hitting around just under 800 deaths. I know
right.
that doesn't include any figures from care homes. These are only deaths in hospitals, so the
Yeah,
figures are misleading.
yeah. So they're registered deaths in hospitals and not care homes and individual homes as well. So we
Yeah.
don't actually know the true figure. And I mean, I watched a few YouTube videos of Piers Morgan hammering some of the cabinet ministers about the stats, the real stats, and
Yeah.
they couldn't provide an answer. So he was quite livid, to be honest with you. So yeah, we don't. That's in terms of deaths, but in terms of transmissions, we unfortunately we don't know the real figures because unlike other countries, we're not doing widespread testing and contact tracing. Uh,
Hmm.
so we're going by the general advice that if you have a temperature and a new continuous cough, to isolate for 7 days and for the household to isolate for 14. Now, on that, these people who are expressing new symptoms, they're not being tested, so we won't know really the reality of how this virus has spread through the country. We just won't have that accurate figure. But anecdotally, we do know that the virus has spread significantly, and people are expressing symptoms,
Hmm.
even though they might not have been tested. And the reason for that is simple. It's a virus that there's no immunity to. It's a new virus that's evolved from a previous virus, and there's the level of transmission is out there. It's transmitted from one person to another, and if you do get that virus, you will have a response to it. Unlike the common cold or the flu, you might have some level of natural immunity to it, or through vaccination. So that's why the level of transmission is going to be high, and that's why it's a global pandemic, because there's no immunity to it yet, either natural or through artificial means via vaccination.
Hmm. One thing that has been interesting, though, again, speaking to the wife who works in hospital and to other friends, the number of cases that they have in ICU and critical care wards in hospitals is a bit stretched.
Yeah,
But what I'm hearing is that they started clearing wards, other non-COVID-19 and non-ICU wards,
yeah,
a few weeks ago, on the expectation that the numbers are going to be increasing of patients who might be expressing symptoms,
yeah,
which has, but they've not been getting the admissions of patients with other conditions in the same numbers as they were expecting.
yeah.
So the medicines admission units, Alison was saying it's quieter than normal.
And
It's not the others.
do you know the reason why, Saghir?
What do you think? Yeah, go on.
I kind of know the reason why from my general practice hat on.
Yeah,
So two reasons. One is patients themselves are reluctant to go into hospital at the moment,
yeah,
because they fear that it's a hotbed of COVID, and if they go in, they're
yeah,
likely to contract the virus. And the second thing is, in terms of appointments, referrals from primary care, i.e., GP surgeries,
yeah,
they're not referring in the numbers that they were previously, based on for two reasons. One is that they're assessing on a level of urgency. So if it can wait, they're adopting like a wait and see approach, like a delayed tactic. And two, the guidance seems to be changing every day. It is a little bit confusing, even for those that are working in general practice. But on one hand, I remember a guidance that we read a week ago, which is that if it's non-urgent and it can wait, and they gave a list of what is classified as urgent and not, wait. And then the next week after that, the guidance was, you can still refer, but we don't know when the referral dates will come through. etc. So it's just all a little bit confusing. And then from the perspective of those outpatient appointments in secondary care, most secondary care appointments had been cancelled initially. The face-to-face of those that are on see a consultant, let's say every few months, every 3 to 6 months for their bowel condition or for whatever, for their cardiac condition, they all got cancelled. Some of them got switched to phone appointments. So people aren't coming in for all those reasons. And yeah, there is definitely a fear from our patients, both in community pharmacy and general practice, that they feel that they don't want to go to hospital.
Yeah.